Thank you for this opportunity to present my work. We looked at the role of HLADPB1, 0401, and PR3 peptide. We followed patients with ANCA vasculitis prospectively and collected samples from active patients, patients in long-term remission off therapy, as well as healthy individuals for the experiments here. We used in silico studies followed by in vitro competitive binding assays to identify parts of PR3 peptide that are that bind with high affinity to HLA-DPP1 0401. And then we tested this using patient PBMCs, and we looked at HLA-DPP1 expression and interaction with the peptide that we found. And lastly, we used tetramers to identify autoreactive cells. So I'll go through some of our results here. In figure 1, I show you the risk of relapse based on carrying HLA-DPP1 0401. As you can see in PR3 ANCA, carriage of this risk allele that's denoted by the dashed lines is associated with increased risk of relapse, hazard ratio 2.06. In MPO ANCA, there is no difference here. And so our next question was whether there's an interaction between this HLA-DPP1 0401 and part of PR3, which is what we did find a specific PR3 peptide that directly interacts, as predicted to interact. And so we tested this using patient cells and also from healthy individuals. All were carriers of DPP1 0401 allele. And interestingly, what we found is that there's a varied amount of interaction in patients who are being actively treated for vasculitis. However, in patients who are in long-term remission of therapy, the DPP1 and PR3 peptide interaction is essentially normal, comparable to healthy individuals. And so we wanted to understand whether this interaction is pathogenic. And we used patient samples and expanded in vitro with this specific peptide and identified autoreactive cells using HLA multimers or tetramers. What we find is pre-expansion, there's no significant autoreactive cell population. However, after 14-day expansion with the peptide of interest in patients, there is increased autoreactivity that is not seen in healthy individuals and not seen with other peptides that were used as controls in patients or healthy subjects. We see that this autoreactivity is increased in 2 patients during active disease, but decreases in remission. So I've shown you here that HLA-DPP1 0401 is a genetic association, but also has an immunopathologic mechanism to explain the increased risk of relapse. I've also shown you that the interaction between HLA-DPP1 and the predicted PR3 peptide is essentially normal when patients are in long-term remission, indicating that they may have non-responsiveness. And so with that, I'm happy to take questions, and thank you for tuning in.